The Quick Response Treatment Program is an assessment and stabilization program for clients who are suffering from mental health, addictions, or concurrent disorders issues. The program is offered by a multidisciplinary team who really work in an integrated and coordinated fashion.
The reason we call it the Quick Response Treatment Program is that clients may access this program within 3 weeks. Within a physician referral or a self-referral, they can be in this program within a very short period of time. And it takes a few sessions also to have a maximum impact on this specific clientele.
Traditionally, the system has been developed really to look at care when people most need it, and often this is when they are in deep crisis. But this is really looking a bit forward, preventing to arrive at that stage. So that's a very innovative approach.
There are so many different programs out there. There's the mental health world, there's the addictions, concurrent disorders. What's special about this program is that it treats a very specific group of clients. These people that are not quite in crisis, but if we left them there waiting on a wait list, they will be in crisis. They'll end up in the emergency department, or they'll have to request sick leaves from work or be hospitalized. So we need to take care of this group of people, and we can do it. We have the capacity to be able to treat them rapidly in a few sessions, and that's what the QRTP is all about.
This program was quick help right at the good moment of my life and my crisis. I felt I was supported. I liked that the accessibility, it's in my hometown. I don't have to travel to get the help.
We're quite fortunate to have the Quick Response Treatment Program. Clients are seen in the community, and the bulk of the work is done by 2 of our agencies. Our adult mental health clinic called Royal-Comtois Center, and our adolescent and adult addictions clinic called Addiction Service of Prescott-Russell.
People are coming in with a variety of symptoms or problematics. We see people that are depressed or suffering from depression or suffering from anxiety symptoms. Some are relationship issues. Some have housing or financial issues.
The Quick Response Treatment Program team is comprised of a psychotherapist, a social worker, a psychiatric nurse, an occupational therapist, and a psychiatrist, all supported by a well-organized clerical staff.
These clinicians are able to really see what's underneath the symptom, underneath the presenting issues. And once we really understand the situation, we say, yes, this is the right program, we can offer something and we can make a difference here.
As a social worker and psychotherapist, my role is first to help the client assess his situation, to determine his personal goals, to identify the key persons in his social, professional, and family environment. Then I provide psychotherapy services, act as liaison with community resources, and provide mediation with family members.
As a psychiatrist with the program, my role is to support the Quick Response Treatment Program team to select patients who would benefit from a psychiatric evaluation.
What makes this program work is that I can count on the expertise and support of my fellow team members from other fields of practice. The client can then benefit from this whole team of clinicians, not only one professional.
The program is client-centered and gives them the tools to self-manage and to recognize symptoms in order to participate actively in their own care.
Patients that have been referred say they're very satisfied. They've been treated with such care, compassion, professionalism, and competency. It's very encouraging for a family physician to hear this.
The most frequent feedback I receive from clients who went through the program is that they felt they were cared for. They definitely appreciate the fact that they receive personalized services in a timely manner.
This program helped me. Now I have a normal life. I have hope for the future. Since I've been doing this, I started school, I go to gym, I walk, I have friends. I'm very grateful for this program.
One of the key result areas that we're looking to achieve over the coming years is to make sure that people with mental health and addictions conditions can access high quality services where and when they need them in their communities. And the Quick Response Treatment Program is a beautiful example of an initiative that will help us do just that.
We know that every dollar spent in mental health and addictions saves $7 to the medical system. The Hawkesbury General Hospital is committed to further strengthening its mental health and addictions program, and the Quick Response Treatment Program fits nicely with our strategy and was designed to deploy services in the community to avoid repeated emergency visits.
Patients ended up on long waiting lists or would come to emerge with frequent visits. So we needed something to address their needs. The Quick Response Treatment Program is a perfect solution. It is making a big difference to our wait times in the emergency department, as well as freeing up visits in our offices, thereby improving our accessibility.
In fact, in the last year only, the program reduced emergency department visits by 57% for those clients visiting the program. An enormous achievement for everybody involved.
The Eastern Counties is a region which faces several socioeconomic challenges that impact people's health status, whether physical or mental. And our expanded mental health and addictions program is an integral part of the core services of the hospital. We are pleased that the Champlain Local Health Integration Network recognized the strengths of this program from its inception.
There are about 200,000 people in the region of Champlain that have a mental health condition and/or an addiction. And in the eastern part of our region, it's over 35,000 people. And that was one of the factors why we chose Hawkesbury to pilot with, to test a new way of delivering healthcare services to those individuals.
The Champlain LHIN is very proud to be involved in the Quick Response Treatment Program because it has shown very effective results and it's made a big difference in the life of people. So we can talk about the faster access to services, the reduction in hospitalization or visit to emergency, but what's most important is what we hear from people who have experienced that program and how much of a difference it has made in their life.
We are looking to see what we can learn from this type of approach and how we can help spread that across the region. It may be that we're able to replicate certain components of the program, or in fact the program itself, in other parts of the region of Champlain, or we may be able to build in some of the elements of this program into the type of services that we're already providing.
We're going to keep using this program because it works. It would be nice to see this program in other areas of Ontario.